Hey, y'all, welcome back to another episode of Kelvis Podcast. Man, I am truly blessed to have two of my favorite people from the Heat Lab in the building with me today. And we just got through doing a community event, and it was outstanding. I thank God for the people that came out, and I thank God for these two beautiful ladies that I'm sitting between today, two very educated ladies. So I'm not going to bore you. I'm going to let them introduce themselves to you, starting to my left and to my right, and tell you their bio, and then we're going to jump straight into it. So now you should go ahead and tell the
Yeah.
Kevin's podcast people about yourself.
Hello, Kelvis Podcast people. I'm so glad to be in the room, to be on the podcast today. My name is Naisha Frey. I'm originally from Raleigh, North Carolina. I am a proud FAMU Rattler, and I have a background in psychology as well as public health. I'm currently serving as the clinical research coordinator for the Updo's Protective Styles clinical trial. And that's one of the main reasons why I'm here today. I'm sure that there's more that you'll get to know about me as we talk. But I have over 20 years of experience doing health equity research, and I'm glad to be a part of the Heat Lab and especially glad to be on your podcast
Hey, I'm
today.
glad to have you. Definitely glad to have you. My sister.
All right. So, hello, everyone. My name is Shanita Randolph, and I am an associate professor at Duke University School of Nursing. I have a PhD in public health. My master's degree is also in public health, and I am a BSN. So, I have a Bachelor of Science degree in nursing. I've been a nurse for about 26 years, and I am the founding director of the Heat Lab, which stands for Addressing Health Disparities Through Engagement, Equity, Advocacy, and Trust. I'm a nurse scientist, so meaning that I engage in research, behavioral research, looking at the development of culturally and socially relevant interventions to address health disparities, particularly in the Black community. Principal investigator and lead the Updo's project, which
Right.
we're going to share and talk with you about today.
Definitely,
So
we'll definitely talk about that.
thanks for having us.
Man, I've been trying to get you on the podcast about a year now, but you're a busy woman traveling everywhere. Both of y'all are very busy, and so I just thank God this kind of came together today. Um, so when I was at one of the one of the classes at Duke, and they was talking about the disparity of healthcare within Black women, especially even women that are professional Black women.
Mm.
Can either one of y'all don't mind which one of y'all talk about that? You remember I was there for that class. Can either one of y'all talk about? I don't think you was there. I think you was only there when I came up there for that class. So how relevant is that in the healthcare, the disparity within especially professional Black women or just Black women? Period. The healthcare disparity that's there.
Yeah. So when we think about disparities, right, we're thinking about our outcomes being worse than other outcomes of other races.
Right.
Our work, particularly for this project, focuses on HIV, but we can look at inequities in health care delivery, healthcare access, healthcare outcomes for the Black community in general, right? And so we have higher rates of cardiovascular disease, higher rates of infant mortality, higher rates of HIV, and there are a number of things that play into that. Structural racism being one.
That's true. Very true.
Our systems and how our systems are structured in such a way in terms of accessing care. And so Black women in general do have some higher rates of diseases, higher rates of mortality, morbidity as well, in different areas of health. And so, we're just really committed to making sure that we're addressing those health disparities through engagement, through equity, advocacy, and building trust with the community in doing that.
And so, Natasha, we were talking earlier about the current political geo spectrum that we in, and as both of y'all know, with the health cuts that's coming next year in Medicaid, how do you see that impacting rural Black communities from a scientific point?
Yeah, so from specifically a public health science perspective, which is what we're talking about, it's Medicaid cuts are going to impact all of us, but especially rural communities. One way that it's going to affect rural communities is that you all know that there are a limited number of healthcare options where you can go to get different types of healthcare. And so oftentimes healthcare providers depend on those Medicaid dollars to
Right.
keep their doors open,
Sure.
to
Yeah.
keep their practices operational, and to make sure that they are able to provide a high level of resources and care for their patients. So when those dollars are cut, it affects those clinics, those hospitals,
Mhm.
and various practices, including mental health care.
Oh
So
man, that's big.
one of the things that we think about is comprehensive health care, not just what happens if you break, a bone and need to go to the ER, or what happens when you get the flu, but also, to what we were talking about before, some of the mental health issues that we as a community, and specifically Black and African American women face, affect our mental health,
Right.
which then also can translate to our physical health.
Yeah. And even in the VA world, so of course, I have TRICARE and I have the VA. But one thing I can share with you, my doctor's not even in North Carolina anymore. I'm doing, and this is the first time outside maybe a specialty care I did telehealth. But for my primary care, now I have a team that's not even in North Carolina. She's in upper northern part of Virginia. She's good. Don't get me wrong. I like her. It was the first time just last month I went and did my annual checkup and stuff like that, but it was telehealth. And so across the board in the VA, they've cut a lot of positions with staff of nursing doctors and special care doctors. So it's not only affecting just the community as a whole, but also it affected the veterans community as well with their health care because, all of it runs together in some fashion and form. You know what I'm saying? So that is, yeah, it is definitely a big change in how things are being done now versus that. But I want to hit on something that's very important to me, and that's mental health. And I said it so many times on my podcast. I never understood. I do understand because of where we come from. Me and Shanita come from the same background. And it kind of like you don't talk about, we raised what goes on in our house stays in our house. And a lot of things that happen in the Black community, especially in the rural communities, has mentally affected a lot of us, not only just women and men.
Yeah.
But I always find it amazing to me that in our community we shy away from mental health, and I understand it was not something that available to us because I didn't know anything about mental health until I went in the military, and it wasn't until I came back from combat that I had to seek mental health, and I don't mind sharing that. But but in the field of when I really started out talking about podcasts and mental health for men and disparity with men health and stuff like that, and I've talked to numerous women. What I always find is amazing is y'all feel like y'all have no mental health issues. That is just amazing to me.
That we do what?
Don't feel that you have any mental health issues.
What women you been talking to?
Oh, but let me tell man, let me tell you, from DC down to Atlanta, and RJ can witness it. I have, and even right here in North Carolina, I got some good friends of mine, and one told me one time she was afraid to get mental help because of what she may learn about herself.
Oh.
But it when you tell special African American women that you think that they may need to seek counseling, they get offended.
I think a lot of people do. I mean, I've seen similar things talking with men and women. I think oftentimes people are very much afraid of what they might learn about themselves, things that they might need to change. Change is difficult. And so oftentimes, sometimes what you might realize is that there are things that you may need to let go of, and sometimes letting go of things creates a process of grieving. And some folks don't necessarily want to let go. They may not want to grieve. Sometimes there's sadness or what they carry around with them that may be causing problems. In some ways might even be a comfort, just a sense of normalcy. And so the idea of changing what they think is normal might be really, really scary for them. And so I think that kind of gets into, as a culture, general culture. I could even, extrapolate that out further to, American culture. Right. We do have this sense of perfectionism that we try to uphold. The American dream is built on this one very specific type of way of living and being. And so anything outside of that can seem like you're creating or putting yourself in an other category. A lot of times people don't want to be othered or be seen as different. We're oftentimes socialized to want to go along with the program. Right. And so any deviation from the program is not always supported, right? And so that's when you get into things like stigma. And that's something that's very much a part of what we do with the Heat Lab
Right.
is address things like cultural stigma, like sexual and reproductive health stigma, that prevents people from being able to seek the care, whether it's mental health care or physical health care that they need, being able to communicate and talk to their doctor about what's going on with them, especially when it has to do with those really intimate spaces.
Right, I understand that.
Yeah.
But you need but I'm gonna ask you this question. I'm gonna let you've been married what about 30?
21.
Okay,
21. I'm about to be legal.
Okay, definitely. But from your standpoint as somebody that I adore and respect, and you've been married as many years you have been, um, how's that mental health played a part in y'all marriage and just in your relationship before you even got married? Was there anything that you felt like you carried into your marriage from previous relationship before you got married?
I think that we normalize things that aren't normal.
Okay,
I'll
elaborate.
pause.
Okay.
So I think like from your comment, and I think as Naisha was speaking, when we, our focus being on Black women, our focus is on Black women and HIV prevention. But what we also understand is that we're looking at the whole woman, right? And so even in our work, we don't just address HIV prevention. We also address cardiovascular disease, intimate partner violence. And so whenever you look at what we normalize, things that aren't necessarily normal. Like when we think about resilience, we say that as a woman, I need to be resilient. I'm resilient. And we have touted that as being a positive thing. But Black women hold a lot of responsibility.
That's true.
We do. We
Yeah.
hold a lot of responsibility in every aspect of our lives, right? And so, as our focus is around sexual health, we also understand that there are social determinants of health, where women work, where they live, and where they play, and the number of hats that we wear, right? And so, when we think about our mental health, we've normalized those things that are not normal. We weren't created to carry everything on our backs.
That's true.
We were not created to carry every friend, every family member as our responsibility, every person in the community, and we carry a lot.
Right.
And so I think that we normalize things that aren't normal. We weren't created to carry as much as we do.
Right.
Right. And
Okay.
so, so when I think about this thing about mental health, and your point of when you first asked the question that there are some that may not think that women that don't think that they need that. We sometimes don't know what it is that we do need. And I think as a community, particularly as a Black community, we do, because we've carried those things that aren't necessarily normal. It's not normal for us to go through the trauma, whether we have gone through it directly or whether we've just seen it.
Right. Right. Yeah.
We've seen the killing of George Floyd,
Right.
right? But George Floyd wasn't the first for us.
No.
Like, we've been experiencing that. We've seen the microaggressions in the workplace. We've not just seen it, we've experienced it, and we've carried it. And we've carried it as if it was normal.
Right.
And in return, it has had an impact on our health. It's had an impact on our relationships.
Yes.
It's had an impact on our families, on our marriages, right? And so I think that there is space for us taking care of our mental health, as to normalize that, right? Our sexual health decisions, as we're thinking about, bringing this awareness to Black women and to HIV prevention, there's space for removing stigma.
Yeah.
There's space for removing what sexual health is and what sexual health is not. There's space for removing how do I make a decision to take care of my own sexual health and what those decisions are. We've stigmatized that.
Yeah,
And
that's true.
because of that, women, when we think about even PrEP, and we'll go into that, that's pre-exposure prophylaxis.
Yeah. Just carry on. I'm with you.
Which is the medication that if taken is 99% effective of decreasing someone from even getting HIV. But we've put stigma to that. Like, there's stigma attached even to that, if I take that, then I'm having sex or I'm promiscuous, or people will think that I'm already HIV positive,
That's true.
right?
Definitely. That's definitely a stigma
So
there.
all of that plays into stigmatizing our mental health piece, and it plays into even our decision making.
Two interesting things I heard you say today, and the two things you said that kind of sparked me. Um, if you look on TV across the media, you see a lot talk about two men in being in a relationship. But to your point, I think you said something today about it. You don't see where PrEP or taking something to help prevent attracting or catching HIV is normalized on in our world right now in social media. You see that part, you don't see the other part. And you're right too. If I was a guy and I went to and I didn't have the knowledge, right, about prevention, and I went in the bathroom and used the bathroom, guys knows it's like female, I'm just saying. And I look in your medical cabinet and I look and I see something in there, chances is I'm like, oh no, she's HIV positive. So oh no, I'm gonna make a phone call. Hey, call me in 5 seconds. I got a bail. And that's just because there's not a lot of knowledge out there. It's not talked about enough that we can understand that point of view about what you just said about taking something that would help minimize you catching HIV.
Yeah.
And even normalizing the conversation between couples. We haven't normalized sexual health and reproductive health conversations. It's a lot easier to talk to somebody about whether or not they want to have kids, right?
True.
Or if they see themselves getting married, or if that's what they're looking for in their relationship. But what we don't talk about is, without judgment and without stigma, have you ever contracted a sexually transmitted infection?
Right.
Are you currently taking medication to manage a sexually transmitted infection? And knowing the numbers that we know, there's a lot of people who have had that experience before,
Have
right?
you had an HIV test?
Right.
Do you get HIV tested?
Right.
Yeah, that's true.
And so there's oftentimes, because of that stigma, so much pressure around that conversation.
Yeah, it is. Yeah.
So much awkwardness around that conversation. It feels so heavy. Even though it's so necessary. That conversation can be the difference between life and death.
That's true.
Yeah, because the
Right.
more it's shown and proven that the more STIs that one has had, it's definitely a risk factor,
Right.
putting them
Yeah.
more susceptible, of course, to HIV. So those are conversations that are definitely needed, and they all go back to mental health.
Yeah. Yeah, definitely. Mental health.
Tied in.
Yeah, mental health is, man, I'm a big advocate of that,
Yeah.
Truly am. So let's talk about when you started this, what was some of the trials and tribulation when you said, hey, I'm gonna, do whatever it is you had to do to start this process. What were some of the trials and tribulations that you ran into, or pushback or obstacles that you ran into?
Yeah, so the Heat Lab, again, is addressing health disparities through engagement, equity, advocacy, and trust. So particularly, we look at different health issues, particularly though today we're focused on HIV and Black women. And so I think some of the challenges with our work, we do this work even with updos, using PrEP, doing it for ourselves, protective styles was co-designed and developed. It's an intervention that engages beauty salons, women through entertainment videos. So we have a 6-part series. And you mentioned telehealth. The third component of updos engages a telehealth company where women can actually access HIV testing in the comfort of their own home. They can speak to a telehealth provider in the comfort of their own home to learn more about PrEP. And they can actually have PrEP delivered to their home as well.
I didn't know that.
Yeah, so using PrEP, doing it for ourselves is a 3-part intervention. So some of the challenges, I think, is, again, I'm a nurse researcher, I'm a nurse scientist, right? In this space, we have the Institutional Review Board. There are processes and systems within higher education of research that we must follow to make sure that, as Naisha says, we're dotting our I's and crossing our T's.
Oh yeah, she made that point very clear.
Because
Hey,
historically,
it's good. That's
because historically, with reason,
I'm sure.
with lots of reason, and not just historically, current day reason in our healthcare system and in research as to why we may not participate as much as a community, right? And so some of the challenges of that are realizing that I'm doing this with the community, not on the community, with the community. So Updo's was created in partnership with 3 beauty salon stylists. And some of the challenges of that is that our systems are different. And so our system of higher education and research is different than if they're in the community. We have a problem, the boots on the ground, grassroots organizations, we going in and we're about to fix it. Oh, Updo's is ready? Oh, we're giving Updo's to every beauty salon, every stylist is going to get the training, where research says, hope, we got to go through a cluster randomized control trial first. We need to make sure that we have the evidence and the scientific rigor behind what we're doing. We have to have the methodology behind what we're doing. We got to test it before it becomes an evidence-based intervention, where the community is like, oh, we got a problem. There's over 50% of Black women are getting HIV through heterosexual contact. Let's fix it now.
Right. Oh, yeah.
So the biggest challenge, I think, has been partnering with the community, which is there's no other way that we're doing it in the heat lab.
Right.
If it's not real world delivery with the community, we're not doing it. But that's a challenge because we also are in our research space.
Right.
And so that's the biggest thing for me. But our larger goal is, when we think about evidence-based interventions that are available through the Center for Disease Control or that are available for other healthcare entities, we don't see any that are focused on Black women. And so our goal is we're going to meet that challenge from the research perspective and get Updo's to be that evidence-based intervention that's available widespread that focuses on Black women.
Yeah.
So we're up for the challenge.
Yeah, definitely. And you know, when I was on my bachelor's degree, I did a research. It was part of our project, and I didn't know this until then. And so when you say that about the dotting eyes, crossing the T's, I said early in the meeting, and she's on it.
She's like, hold on a minute
But
now.
back in the
Wait a
60s,
minute.
yeah. But back in the 60s though, and I know that's a long time ago.
Not that long. Go ahead.
Tide and Clorox, especially Tide, right? The company on Tide. I don't know who the family on Tide, but long story short is, upstate New York, they was putting patches on Black people to see how they would react to Tide and bleach and different things. And I'm sure they didn't dot all their I's and dot all their T's, because in the research that we did as a group project, and a lot of them people couldn't read. A lot of them could not read those big words that these companies had put in this thing. So basically they were saying, okay, we're not taking responsibility for any, adverse medical help. But it did tell them that, hey, we will provide medical care in a prison, right? And they would give them money on their commissary. They would give them whatever it was, maybe $20, $30. Back then, it was probably a lot of money when you locked up. But just to think about it, how they did Blacks, and it was historically Blacks in this prison upstate New York and Maryland. They did all these research to see how Tide and different things.
Yeah.
So when people think about pods and things you put in the dryer, now to put in, they was doing that research back in the 60s to see how it would affect, people, but they used Black people as they research to develop those things like Tide and all different types of laundry detergents and stuff. And so when you said that, it just triggered back that research class that we did that, we go back to Tuskegee, University, what they did there, what I'm saying? So I can see, and to the point that as an African American, we kind of a little bit cautious when you say, hey, I'm doing a research project, because, history is there, what I'm saying? And people still remember, even though it's been some years, that still, and that triggered that memory in me about that class just now, that, how they did things back then.
Yeah.
You know what I'm saying? So
definitely distrust, again, that is granted, right? Like Henrietta Lacks.
yeah.
Like when you think about our medical system, not just research, but the healthcare and medical system, we don't even have to go back historically, back in 1960. I can go to last week. So you are still having to face that. So I think that's why it's important in the heat lab, is that even today, as we are looking at being engaged in 6 counties throughout North Carolina, Cumberland being one, Guilford, Wake, I always miss one, Guilford, Wake, Durham County, Forsyth County, and Mecklenburg counties are the counties that we're looking to engage in this particular work. But even today, it was important for us to have a meet and greet
Right.
with gatekeepers, with opinion leaders before we even engage in recruitment for the Updo's project, because we want people to know who we are, what we're doing, why we're doing it, and exactly what's happening.
Right.
And we're true to that.
Keeping it real.
And we're keeping it real. We're going to
Yeah.
answer any questions. We don't just do that now, but even at the end of this, we go back.
Mm-hmm.
This is what we found. This is where we are now, and this is what's next. That's our pattern. That's just who we are, and it's important to do that. Whenever I've engaged beauty salons previously in my work, one told me, I've been in a research study before, but they never came back. I have no idea what happened.
Right. Yeah.
No, we don't. That's disrespectful.
Right.
That's disrespecting people's time and their space. So yeah.
Yeah. I just want to add a little something to that and give a shout out to one of our mutual colleagues, Dr. Nadine Barrett, who's at Wake Forest University. And she does a lot of research on exactly the topic that you just mentioned. And a lot of the research that she has discovered is that most people, and this was before she even started, but most people participate in research because they believe that even if it doesn't help them personally, it may help people in the
Somebody else.
future,
Right.
right?
Yes.
And so that is across the board one of the reasons why people will say yes, right? And so some of her research was looking at, well, why is it that we're having such a hard time, recruiting non-white male participants, right? And people who are in the middle to upper middle class, they tend to, kind of populate a lot of these studies. But we know that there's so much diversity outside of those categories.
Right.
And so one of the things that she found was that people just weren't asking Black people to participate.
Exactly.
And so that's one of the things that sets us apart and how we're kind of building off of the spirit of that research. She has a whole research study around Just Ask, and it's specifically for researchers, healthcare providers, to help them understand their bias that might prevent them from
Yes.
speaking to a person of color, that might prevent them from speaking to a woman, because they might make a whole bunch of assumptions that may or may not be true.
Right.
And we all know, as high performing individuals, we can have our plates full and still figure out how to take on more,
Amen.
right?
Amen.
In a way that makes sense for us. So even if you have it correct in terms of your understanding that, oh, well, this person is just way too busy, they've just got so much going on, so much responsibility, you still should consider really giving them a fair option to opt in or out. And so that's another aspect of why we do community engaged research and why we focus on our community. One, because it's who we are. And so we can do that authentically.
Right.
But also because we recognize it's important to bring the research to our community so that we can gain that data and that insight and that evidence.
So you said something that triggered me, and I'm a guy. I listen very carefully. So when you say we all balance, and you say I appreciate you throwing it in high speed balance. I appreciate it, but I don't see myself that way. But I appreciate the compliment though. But let's talk individual, both of y'all. I mean, to get where y'all are now, I think my audience would love to hear. You don't have to share all of some of the challenges from your bachelor's degree, if you have associate up to now, and just in your field. What's been some of the challenges you, not only personally but professionally, that you have faced?
Yeah, so I can say for myself, I think one of the biggest challenges that I had was confronting institutionalized racism in higher education.
Mm.
I was prepared, but I was still managed to be really surprised at the extent that there is institutionalized racism in higher ed. And that has to do with graduate school. I come from the generation, and I think all of us, our parents, our grandparents, our churches, what have you, instilled in us, it's very important for you to get your education.
Yeah.
And go as far as you can in your education, because those are opportunities to open doors and pathways, and just for you to expand your mind and your
Right.
worldview, right? And understanding more about the world that you live in. And so education just seemed like such a broad panacea of opportunity. And so when I got to a certain level of education and saw the level of dismissiveness,
Mm. We're
um,
gonna use that word. Okay, we can use that word. We're
yeah,
gonna keep it
use
real on
that
Kelvis
word.
podcast.
No,
But we
I
keep it
mean,
real. We keep it real.
I'm gonna start there with dismissiveness, right? So there's dismissiveness. There is, just cultural incongruence where it's like, you're going through something that relates to your family or relates to your social network that helps to, strengthen you,
Right.
and something happens and it affects you.
Yeah.
But people expect for you to be resilient on their time,
Mm.
right?
Mm.
And then they say, well, if you're not bouncing back quite as quickly as people from my culture, then maybe you're not serious. Maybe you're not the right fit. And so those types of challenges, being obstructionist, having obstruction policies that prevent or make it really difficult. I won't say prevent, but make it really difficult for women of color, speaking for myself, Black women specifically, to advance and matriculate. And then wondering, well, why don't we have as many Black scholars or Black researchers or Black PhD or Black faculty? And it's like your whole program to get there is made based on the premise of we must weed out.
Mm.
There can only be one.
I'm gonna let her jump because she's doing a lot. Oh no, that's I'm gonna let her. She was doing a lot of amens over there, and I know where she's from. So let's go on, sister. Go on, preach about it. What's been your challenges?
So I'm a PhD prepared nurse scientist.
Mhm.
There's less than 1% of us are Black. I'll pause.
I remember you saying that in one of the classes I was in.
Less than 1% of us are Black. So for me, whenever you think about health disparities and addressing health disparities from a research perspective, as a nurse scientist, PhD prepared, less than 1% are Black, but majority of the work that we are addressing are around communities of color. So you do the math on who's doing the work, who's leading the work. And although that is okay in terms of diversity, equity, and inclusion, it's a problem.
Right.
There needs to be more of us in that space because the lived experience adds more value than what is given, right? And so I think one of my challenges has been the same, just being in this space of being overlooked, silenced, and underestimated. And I think that it's probably the story of your audience, whether they're nurses, whether they're researchers, whether they work in corporate America. If they Black and they a woman, they understand exactly what I'm talking about. Overlooked, underestimated, and silenced in different spaces, but powerful, game changers, transformative leaders. That's who we are. Right?
Yeah, definitely.
We are those people. Like, we are amazing in every discipline. But we in different spaces have so many challenges, I think, in our work environments. And we tend to not just survive them, but we thrive in them.
Yeah.
So when you think about, when I said earlier, we normalize what's not normal, we've had to normalize that.
Right.
And in turn, it has caused health challenges for us as Black women. And we've normalized carrying things that we were not built to carry, right? And so that has been my challenge. In turn, I'm one of the co-founders of Black PhD Nurse Scientists, where we are engaging a network of those who are Black African American nurses who want to get their PhD or they are already PhD prepared nurses, and we are building a capacity of those who can provide support and social networks and mentoring in that space. Because for me, my legacy will be that if it's just one, that I can help and prevent from going through some of the things that I have on my career trajectory, then that's the greatest success. I'm a fellow in the American Academy of Nursing, and that's great. But if I can go back and mentor one, that's much better than being in FAN.
Right.
That's more than any accolade that you could ever give me if I can help another nurse scientist to go home and be well and do her job. That's success.
That's success. Well, one thing I think, and I got a good friend of mine, who's a nurse practitioner, and her peer group is pressuring her to go to school to, PhD, is the financial part.
Yeah.
Because it's a lot of debt. I thank God I ain't got no student debts. The government has paid all my bills and all my tuitions, all the laptops I got at home. They pay. Thank y'all for y'all tax dollars.
And thank you for your
Thank you
service.
for your service.
But
Earned it.
You
we're
earned
gonna have
it.
to raise y'all taxes 10% next year.
Okay,
I'll pay
all
raise
right,
my
well,
disability and my stuff.
Okay,
Anyway,
okay.
but besides that point, but I am gonna talk to the big boss about
Okay.
that pay raise. But that is even now I think the education and financing has become a big issue because a lot of people go to school, and I got friends that didn't go in the military that's got $1,000 of debt, and yeah, they may make 125, but you still got to live. So a lot of people say, well, why should I go on to get these high levels of education? I'm gonna have all this debt, and the debt to what I may be making may not be significant enough to pay all my bills and pay $1,000, $1,200 student loan back every month,
That's
and they
real.
got interest on top of it.
Well, from the PhD perspective, there are some PhD programs that you can apply for and enter into that will pay you a stipend
What?
to actually go through the
Okay.
program. You may have to get grants or whatever to support your tuition.
Okay.
So you'll see that as well as some opportunities. I get it though. There are definitely challenges to it, into doing that. Most of those programs are going to be at your PWIs because your HBCUs, historically black colleges and universities, there are 3 that have PhD in nursing programs. Only 3. The cost is significant. That's why we have more, particularly African American nurses, that are going for the DNP. Not
Write
only
that down now, because I don't know. All
that's
these...
the doctorate of nursing practice.
Okay, thank you, man. I appreciate that.
And so there's a PhD, then there's a DNP. The DNP is more clinical translation. From that perspective, they look at systems, quality improvement.
Okay.
PhDs are more in the methodology and the research and the scientific rigor of that. Personally, in the Heat Lab, we have both. So one of our co-investigators, we'll give her a shout out, is Dr. Reagan Johnson.
Yeah, Dr. Reagan. I
And
like Dr.
she
Reagan.
has a DNP. And so we think that we love that collaboration because it's taken the science, but it's also helping to translate it into real world, into systems. So we are seeing that a lot of nurses, black nurses in particular, are going for the DNP, not only because of cost, but because of time.
What's the average time for that?
So a DNP, you could go 2 years.
2 years, okay.
You could do up to 2. There are different programs and different concentrations,
Gotcha.
so I won't go into
Gotcha.
all. There are different varieties to do that, but so that's why I'm sort of a advocate right now for engaging more nurses to get the PhD.
Okay. That's what's up. So now, we're going to get back to something. We'll get back to the Heat Lab in a minute, but, I got to talk about something I like to talk about.
Okay. It's
No,
your show.
not I don't love the Heat Lab because I'm a part of it.
Oh,
Don't get me wrong, though.
Because you are a community advisor.
That's right,
at
that's right,
the Heat
that's right,
Lab, and we
that's
do
right.
appreciate you.
So I think that what my title was on that paper.
That's right,
Community
it's on
Card, something.
All of it.
Yeah, all that, all that right there. But, so you've been married. Have you ever been married?
Yes, I am.
Okay. So, I'm going to put this question to 2 very intelligent people. Let's see how it is. What is your definition of unconditional love? Let's start there.
Oh, wow. I think the main thing that I turn to immediately is not romantic love in the sense of what's between a man and a woman, if you're heterosexual, what have you. But my love for my daughter, my mother daughter, is like that to me just overtook my understanding of the capacity of love and unconditional love. Of I will do anything.
So there's no condition on your love.
I don't think so. Not for my daughter, no.
I'll get back with you. We'll get back to you in a second. What you got there?
What's the question one more time?
What's your definition of unconditional love?
What is my definition of unconditional love? For God so loved the world that he gave his only begotten Son, that whosoever believeth in him shall not perish, but have everlasting life. If you can find someone who will give unto you unselfishly and love you as God has loved you, then you found some.
So there's no condition on your love.
Is there a condition on my love? I said for God gave, not Shanita gave.
I'm asking. I got it. That's why I came back to that question. Oh, Shanita love. Is there a condition on your love?
I'm human.
Right, exactly.
Right. Oh, yeah, I caught that very
human.
well.
I seek to be more like.
Amen.
Yeah, amen.
I'm not.
Yes.
Yeah. I mean, when you put it that way, yeah, it's funny though, because I think that you can love someone selfishly, especially when you love someone from the core.
Mm-hmm.
And love is not defined by what you do for me. Love is defined on who you are to me.
Mm-hmm.
Right?
Mm-hmm.
To me. So there's different spectrums to this. You asking tricky questions.
Well, I asked
But
you
love does not mean that if I'm loving you, you can do anything you want to do.
Okay, well,
That part.
that's what I was trying to get to. You know what I'm
Okay.
saying?
Well,
in that sense of it, there has to be some conditions.
Yeah, so we're gonna take them hats off for the Heat Lab. And we're gonna put them down
Now
right
you just talking to Shanita and Naisha.
That's it. We having a conversation right now.
This the part two.
Yeah, this is part two.
Kelvis.
Yeah.
Okay.
Yeah, that's part two.
I mean, because all of it has something to do with sexual health, decision making,
Yes, Lord.
and HIV prevention.
Yes, Lord, it does.
It really-
Amen. Boy.
Yeah.
Woo.
Yeah.
Yes, Lord.
Yeah, no, I agree with Shanita.
So I'm going back to you now.
Yeah.
You take off that, all those degrees you got. And
No,
put that to the
okay.
side.
I'm
Do something
with you.
right.
No, but I'm serious. Like, I feel like, I think in my life, yes, the unconditional love part, the immense love, and even me understanding my mother's love for me and more about God's love for me came through my love for my daughter. But when it comes to relationships, romantic love, the love that I had with my husband, we're divorced, that love did have some conditions on it. I think even in our vows, there are conditions on our love, right? It says through sickness and in health, through all these others, better or for worse,
richer or for poor. That's a condition.
There's some conditions.
I agree with you.
Right.
I'm just trying to get y'all perspective.
Right. Yeah. And so
when
when you start to break those conditions of your vows, then maybe the situation needs to change. I'm also a person that believes that someone can love me and they may be completely sincere. I have definitely experienced this, but they are not loving me the way that I need them to.
Okay. Nice out here,
And so I can't say, oh, you don't love me. Right. I do see and hear your style, your language of love. But that's not the language and the style that speaks to me.
So you trying to get that? You trying to get 100% when you got 80? Well, I'm gonna come back to you. Go ahead, Shannon. Hold that thought. I want you to think about that.
This is my truth. Getting points off. That's true.
That's right.
I got 100, y'all. I got 100.
She got 80. She got 80, but she's trying to get 100, y'all. We'll come back to her. Go ahead, sis. Talk to me.
What?
She's trying to get 100 over here.
She's trying to
You
get
gotta take the
100.
80%.
I'm just trying to figure out what is the 100.
I know.
I didn't
Because you never heard of the 80-20 ratio?
In relationships?
Yeah.
There's no such thing.
Well, why? You got me turning. See, let me get my jacket right. Why is that Dr. Shanita Ramsey?
There's no such thing as 80, 20, 50, 50. Teddy P got it wrong.
Well, let me clarify something for you now. When I say 80-20,
Oh.
let me clarify.
Oh, okay.
Let me put my little education hat on. What I'm saying is a lot of people in relationships, they have 80%, but it's 20% that's not there. That's some part of, as she said, she's seen the love, but it wasn't completely what she needed as part of whoever was showing her that love. So that's why I said she had 80%, but she was looking for 100 because she was the 20%.
Oh, now you explain the 80-20. I get it.
Y'all been out of touch with
But now
relationship, bro.
some folks had a straight F. Some of them had 30. Some folks was on the 20-80, and you're like, oh no.
But
So you got to be careful with that now.
But so you said ain't no Teddy P got it wrong. So how Teddy P got it wrong? 'Cause I like Teddy P.
Yeah, we
I
love
like Teddy
Teddy
P.
I love Teddy.
But how Teddy P got it wrong though? That's what I want to know.
I think that in relationships, you have to come as complete as you possibly can yourself. I think we look to, I used to do it. I used to look to my husband to make me happy.
Right.
That's not his job.
Go on, talk about it. Go on, talk about it.
Like, if I'm not happy
Right.
as Shanita
Mm-hmm.
first, there's nothing that anyone can possibly do, because then I'm like that hamster that just keep churning.
Yeah.
I keep looking for you to fulfill me. And I think that there's a need that we fulfill ourselves first. And then I can get with someone who is trying to do the same. And then there's a different, I think, level of understanding and commitment, I think, in that piece.
Okay. Well, I can see your point. I'm going back over this 20% over here. Now you said some of them had an F. Wait a minute now.
Well, I'm just saying, like, I'm going to talk about another singer that we love. Tina Turner. What's love got to do with it? Sometimes someone can love you, but that doesn't necessarily mean that they're a good partner for you, or that they're a good match for you, or that they're a good life partner for you. So someone can love you, or what they think is love, right? Because I can't tell you how you feel. I can't define that for you. You say you love me.
You can't tell who to sock it to. Ain't that what the song say?
Oh, okay.
He went to another song.
Okay. All right. That part. I'm going to let y'all roll with that. Okay. But yeah, so that's the thing. It's like, I can't tell you, you don't. Yes, I do. No, you don't. Like, who does that? I mean, people do it all the time. But the point is, this person may say that they love you. You may see signs of that. It still may not be enough. They still may not be the equally yoked partner that you need, or that you desire, or that will help you to live a more whole, complete, and peaceful life.
I hear you. So, do any one of y'all know what the divorce rate is in the African American community?
I don't know the stats, the most recent stats, but I do know this. I don't know the numbers.
I do. But go ahead, though.
But we have a challenge,
to say the least. So I think I'm gonna start my research project. I'm gonna need some help. I'm gonna research project that mental health of a man in a relationship, because I think that's overlooked.
Oh, I think that should be looked at.
Yeah, I think that should be. We should put that out there with a heat lab. Yeah, definitely. I think
looking at mental health
of men in relationships.
Because you know what? You know, it's funny.
Because it does have a direct link to the fact that Black women have the highest rates of HIV, and we get it through heterosexual contact.
That's true. I'm not denying those numbers. All right, I got it.
Yep.
But here's the flip side. Since we want to talk numbers today, so I'm gonna sit on up. We're gonna talk about some numbers. You know what I'm saying? Since y'all want to put me on us on Front Street.
No, you
And it's never a blaming game.
No,
I love my Black men.
I know,
yes,
and
I do too.
I'm just declining, but you know, I think that in relationships, a lot of times, and I'll speak for me. I'll put myself out there.
Okay.
You know, I grew up. My mother was a single mom. I didn't have a relationship with my father, not a very good relationship, or a relationship that I have with my sons now, in any form. But my mom always said, you know, several things because she was a single mom, right? And that cliche, happy wife, happy home.
Mm.
But I'm somebody said, and I think it was Dr. Jamal Bryant said something to this effect. If you spend more time trying to figure out why the man's not making you happy, but figure out how you can make your man happy, build a lot more happy relationships. And I think that's true because, you know, we as men, we most men, not every man.
That's
I'm
right.
just putting on in a scenario situation, right? That you know we aim at taking care of our family. You know what the Bible say, provide, protect, and all the good things. You know whether you do all those things in the one or not, but that's the nuts of it, okay? But you know, a lot of times we're not respected, we're not felt appreciated, and we go out here and face the world, and just like you as black women in your professions, and you have faced quite a few challenges, and I'm sure more than you have said here today. We face challenges too.
Of course.
You know what I'm saying? Out here in this world, and then when we get beat up, we come home, and then we have to deal with family issues and stuff. You know what I'm saying? And that affects our mental health. Affects our physical health, the stress, and those things that leads to other problems, drinking and abuse of drugs and things like that. And so I think that in the health field, just like the He Lab, that there's a lot of things that has to be looked at. You know what I'm saying? Especially when it comes to man and just overall health of people, period.
Yeah.
You know what I'm saying? So yeah, I think that I'm gonna put me a grant together.
There you go. Please
we're
do.
gonna look at this.
I like the spin on that though, because I think that like as we're focusing on Black women and health, where do we integrate the role of men in prevention and mental health? I think in that as well. So I love that that spin on it, and I think it goes without acknowledging the trauma, and I'll call it that. That I think our Black men have experienced. One case and scenario, like I won't put people out there that are tidily connected to me because they didn't sign a consent for me to call them out.
Right.
But I have a family member who him and his friends were coming from somewhere and pulled over by the cops. I think maybe the guy was speeding a little bit. He wasn't going crazy about it, but the dogs, they pulled out the dogs to search him, laid him down on the ground. That's traumatizing.
It is very much so.
But it's norm.
Mm-hmm.
And so again, we've normalized, I said it earlier, we've normalized things that are not normal.
Mm-hmm.
We've carried the weight. You, as a Black man, you've carried the weight of that. And society and our culture says that you can't talk about it. You just take that. You know what I mean? To come home, to get home safely every day, within itself can be a challenge, right? Especially when we went through this phase, and it's still happening, but I think we went through a phase where it was just magnetized.
Yeah.
Right? Am I going to make it home? I don't want to get stopped by the cops. I'm out here being the businessman, doing my thing, and I'm getting, they're generalizing me, or I'm getting pulled over because I'm Black. That's a lot to carry within itself.
True.
That I don't think there's been space to recognize it as an epidemic, as a pandemic. Enough has not been contributed to recognizing it as a public health problem.
That's very true.
And you carry a lot, a whole lot, and it translates. It translates. It translates even in the context of what we're talking about. What's an anxiety reliever, a stress reliever? Sex.
I don't give me a high five.
right?
There you go.
But if we don't compartmentalize that in a healthy way,
Mm-hmm.
you see how this domino effect keeps happening?
Yes. Yes.
It's a stress reliever.
Yes.
So you may have sex with a woman or more
Mm-hmm.
or someone else
Mm-hmm.
and someone else.
Right.
We're getting HIV.
Right.
You feel me? So I think it is the core of those issues. And again, let me put a disclaimer that I try to use my words correctly. And sometimes, especially nowadays, language can be interpreted and taken. The concept and the foundation of who I am is never to blame any of us.
Right. Right.
It's not a blame to say black men are the problem.
Right.
That is not at all. We collectively, and it's not just a black thing, because we protect ourselves much higher, right?
100%.
100% more. When we look at it and base it by race, we protect ourselves more. More condom use. So again, it's not this blame, but it's focusing in on us because that's what I focus on. So I'm not comparing us right now to nobody else. I'm just focused in on us, right? And so all of that is like a domino effect. Relationships, all of it.
Yeah. And I mean, I'm glad that you brought this up. And, granted, you kind of brought it up in a way to kind of jug us, and that's fine.
Yeah, that's what I do.
Yeah, that's what
I like it.
Right. But, the other thing that it reminded me of was I was fortunate to be on a panel that was talking about HIV and Black women. And I was speaking to the Presidential Advisory Council on HIV and AIDS. And one of the questions that came to me from the council was, what do you think is one of the primary things that we can do to help protect Black women and girls, and help them have a better, healthy life? I said, make sure that they're healthy, whole Black men and boys. Because our Black men and boys are our fathers, our uncles, our cousins, our friends. They are our sons, our nephews, and they are also in some cases, not all cases, but in some cases, our romantic partners, our husbands, our boyfriends, our what have you. Fill it in.
Right.
And so the more Black men and boys that are healthy, whole, strong, that they know who they are, they're confident in who they are, and they are able to go out there and get it, the better off we are.
The better off our families are and our communities.
Well, let me say this, and I like being the devil advocate from time to time, and I'll use that same disclaimer you use about family, but this has been my experience, right? And probably you'll be able to relate to it. I know you definitely will be able to relate to it. The blueprint of how you was raised is a product of who you are today to some degree. Granted, we all came from backgrounds where we didn't have it, and we had some adversity that we overcome. Right? Granted, but I've seen in just keeping it in the Black women, I think y'all hit it on the head. But I'm gonna take it down to the nitty gritty. I've seen family, and I ain't gonna say no names, choose their choice in men, right, was based on how they was raised. And that is some of the problem that the men they choose and the way they choose to be treated in relationship leads to them catching STDs, HIV, because they never had that example, or you said wholesome earlier, I think you used that word, of protecting themselves or having that example of what a young woman should be, how they should carry themselves, and a young man, especially in the community that I grew up in. And I'm not saying it was raised bad. I'm just saying some of the examples they had was not the best. And so even to this day, I question some of my family, especially the females. Why do you choose to continue this process, this almost like a pattern or generational curse some people may use? You know what I'm saying? I got family that's been on Section 8 all their life. That's all they know. And it's been passed down, down and down. So I'm not mad at necessarily the thing of the hub is saying you've been on housing, low income housing for 20 years. But now you should, good God, you should be able to get something of your own. But I'll use that in the context, and I'm not knocking anybody. I mean, I think that's a great thing. We got food stamps when I was a child, so I'm not knocking the assistance people need because it is really needed. And I went to the store the other day and I bought a pack of bacon for my son. He liked it. It was $11 something at Walmart. And I was like, my God, I'm gonna have to go home and kill one of the cows in the backyard and get you some bacon because going to the store is not gonna work for me.
Cow, but all right.
Yeah. But I'm just saying, it was $11 some cent at Walmart.
Right.
He liked that thick oak wood bacon.
Oh boy.
You know what I'm saying? We got some pigs too, but it wasn't ready to kill. But anyway, that's side of the point. But it's inbred in us, you know what I'm saying, to some degree, how we view relationships, how we deal relationship, how we deal sexually with our male or female. It's kind of how it was kind of inbred in us. Until we educate ourselves or make that choice to make that change, we continue that same pattern. And so I think that's an underlying, and I'm not saying nobody looked at it, but it's an underlying to some of the problems that we have when they come to HIV and sexual transmitted because they deal with the same type of dudes. They leave one guy, and the guys, but more the females because there are more females than males. And in my immediate family, they deal with the same types of dude that treat them the same type way.
Yeah,
They
so
leave one relationship and go to the next one, and it's a pattern. And in my mind, I can't figure out why do you keep going down the same way. You expect something different. That's impossible. That's a definite insanity. So y'all can talk about that.
frustrated. So
I'm frustrated. 'Cause I love them, but I don't want to see them. But you can talk to them and you blue in the face, but you know what facing like. You know Clayton Moss, you know what I'm saying. So it's just like, when are we gonna wake up?
yeah, so one thing that I want to encourage is that we are conditioned, right? We're conditioned, whether it's our family, household, and upbringing, right? And conditioning is real. Like the little rat, science projects and all that stuff where, you get them to press the red versus the green and this and that, and you give them treats and blah, blah. That is real, right? And so it happens to us as well, whether we're aware of it or not. So we get conditioned. One of the other things that I think is, we talked about it before in terms of normalizing things that are not normal, right? And how difficult and challenging it is for people to ask for help, get mental health, get the support that they need. Then there's the lack of people who have the clinical skills and licensure and all that other stuff that's available, right? So there's all these different hurdles. The other hurdle that we haven't talked about is the kind of smoke and mirrors that there is in terms of media, communication, what's made available in terms of what do you think your options are. I think some people, some Black women, I probably have been guilty of this once or twice or three times, I'm not sure. But you have this understanding that, wow, Black men are out here having a hard time. They're getting locked up. They're not able to do this. They're filling the circles and the this and the that. And you think, because you've been conditioned through all of this media and whatever else is being told to you about Black men, that there are not enough good ones out there. So I guess I'll share one or two.
Yeah.
Right? Or they all cheat. So I might as well at least get a couple coins to make myself feel better about it. Right? There's all types of stories that we tell ourselves that oftentimes are based on inaccuracies that I would say may have been intentionally planted in our community, or systems that allow that to act out. So even when we're thinking about education, right? And we're thinking about how Black women, Black girls are attacked one particular way in the education system by teachers, by administrators, principals, so on and so forth. Black boys are attacked in a different way. But oftentimes our society has rewarded more Black women because we're palatable, we're women. We're supposed to be less aggressive or less threatening than a man. A man tends to have a lot more of those instances with the police. Not to say Black women do not encounter the police. Right. We do, but not at the same levels. Why is that? And so then when you start to see those systems play out in real time, you witness that terror that Shanita just talked about. Seeing black men getting shot in the street, whether it's by another black man or a cop or whoever. The bottom line is that that's one less black male life, right? And especially if that was a boyfriend, a love, you know what I'm saying? Like that type of trauma that we again have normalized. And the last thing that I'll share is dysfunctional relationships is popular in the United States in terms of what we see on TV, right? And what is promoted through the media and entertainment. So I would say we are concerned about what's going on in the lives of our families and relationships as it relates to Black people, but we're not that much different than what's going on with all our other American counterparts as well in terms of dysfunction. And it doesn't matter how much money you make. That whole mentality of what happens in the house stays in the house. It doesn't matter if you own Section 8 or if you living in the $8 million home. That same type of dysfunction in terms of the way that the man and the woman is interacting might still be playing out, and their children are still watching.
I know you ain't got no family members like that. I just want to put my finger up in the church. I know I was just talking about
No,
that.
I think
I was just being funny when I
Yeah.
said that too.
there's the three things though. I think Naisha hit on it, but 3 points real quickly I'll make to the scenario and to the conversation that you're having. One is I think that we have to be aware of racial and institutional racism that has historically been a part of disrupting our families. And I think having some history and understanding, one of the best things that I've ever done in my career was attended racial equity training through REI. It's the Racial Equity Institute in 2015. It shifted my work. It just shifted me. It gave me a lens of things that our schools should have taught us. Like, what?
Not no do.
So I think one thing that when we're having these conversations, even the Section 8 piece, I think that there's an opportunity for us to understand and have some historical perspective so that we don't give the narrative that we're supposed to pull our boots up, pull ourselves up from the boots. Baby, these boots were put on. So I think that there's some piece to that. That's number one. Number two, in that thing, I would always say one of the best things that we can do in our communities is get out of them. What I mean by that, go visit somewhere else. Go see something else.
Right.
Give your chance and opportunity. Well, maybe I don't have the money. Save some pennies. Save whatever it takes so that you can have a world view. Right? And that may mean from going from one small town to 2 hours down the street. Just go somewhere. Go somewhere and see something different. Right? And it doesn't have to be big. I'm not saying take a flight to Japan. It could be as whatever is within a person's means to see a different worldview and to be around something, someone, some other cultures is important. That's my second thought. My third thought is what I am always try to be conscious to make sure that I don't pick up narratives and continue to tell the narratives the way they've been told. We are kings and we are queens, whether we have $5 or $5 million. And especially in our world of research, we like to build upon the literature, right? Like we build upon science. And even when we're writing and publishing, we're citing other people's work. And that's what we do. That's what we've been normalized to do. And I say disrupt it. Be okay to disrupt narratives. Because just because narratives have been told does not mean that those narratives have been accurate. And I think there's an opportunity for us to disrupt some stuff. Like tear it up from the roots. Because it's easy for us to pick up on those narratives and keep, because we've normalized it's not normal.
Right.
Tear that stuff up and disrupt it.
Yeah,
Those are my only 3 points out of that conversation.
Yeah, and I think that that's beautiful and wonderful. I mean, I think that we also have to recognize that takes a lot of strength. Sometimes courage, strength and courage, to be able to say, you know what, and to know that there's sometimes a cost to be paid.
Yeah.
For tearing it up, because we think about folks, well, why did you sell out? Or why didn't you stand up for that the way you said you was? Or why didn't you speak to that man with that same conviction you had? Because there might have been a cost. Yeah. What do they say? You got to pay the cost to be the boss.
You got to pay the cost to be the boss. And everybody is not willing to make that cost. Whatever space that you've been given the opportunity to occupy in this world, occupy to the fullest of your potential. And if you haven't been called to disrupt, then by all means, go feed your family and do what you're going to do. Somebody's going to be disruptive. And when they are, support them in that. I think that, even with relationships and your piece that you gave an example of, it goes back to the mental health. People make decisions that are patterns and they keep choosing the same thing because I don't recognize that I'm choosing the same thing. Like, I don't recognize that there's a piece of healing that probably needs to take place. And we put it on other people, but it's really me. You are what's in me. That's why I keep being reflective. Like, you reflecting what's in me. It ain't really you. It's me that needs to be healed. Because once I'm healed, I recognize that, oh yeah, you jacked up.
Just like I was jacked up. And I'm not trying to be like that no more.
But I don't want to be like that no more.
So I can't be with you.
Right.
And see, that person might love you. You be like, you so nice, you so kind. But that's not the kind of love I want or need, because I need to evolve.
Not that 20%.
Whatever you want to call it.
Whatever you want to call it.
Whatever you want to call it.
Hey, listen, it's a great conversation. I truly recognize that. Yeah, I mean, you can talk till you're blue in the face, but people, ultimately, we have to make the decision on ourselves. And I think that's really what both of you said, and that's really the bottom line. You have to be able to recognize things within yourself and fix those before you can make a change that need to be made. And then that's, at the end of the day, that's really, I had to recognize it when I came back from war that I was messed up. I was drinking. I wasn't going to formation. I was at the bar at 6 o'clock in the morning. And even then, I didn't recognize it until someone came to me. My first son was a good friend of mine. Said, "Hey, man, you got to get some help because, you're going down the wrong path, and recognize I had some issues. I just came back. And so, and then I, through that conversation, I'm like, man, this is not me. This is not me drinking at 6 o'clock in the morning, This is not me. So I welcome the help. And I think that's when you recognize it and you seek help or you seek to make a change, that's when change is really going to happen. Yeah. So I think we all saying the same thing. So I want you to get the information how my audience can connect with the Heat Lab, because I got something special I need from her over here.
Okay. All right now. So please join the Heat Lab at heatlab.org. That is our website. We are excited for you to learn. We're excited for you to learn more about the work that we do at the Heat Lab, and also to click on the menu option to learn more about Updo's Protective Styles. We are also on Facebook, so you can find us Heat Lab. That's 2 E's, HEEAT, Heat Lab, at Facebook and Instagram. So please join us there and learn more about the amazing work that we're doing.
That's good. Man, it's been a pleasure. I mean, it's going to continue to be a pleasure, but I thank y'all for taking the time out to come sit in the Kelvis podcast. This beautiful studio we have here. And we welcome back, and if you need it in our service, please don't hesitate to call us, okay? But my sister got a new single out, got a T-shirt out, and I remember from your birthday party, I made notes that you are looking at starting your own consulting business in leadership.
Yep.
I believe.
You're listening to me now,
I'm trying to listen to my sister. But before we close this podcast out, I need you to give me a little bit of that song. Just a little bit of. Just give me a little taste.
Oh,
We need
is
some-
it? He just put me on the spot.
Yeah, I put you on the spot. I've been planning this the whole time. While we eating that wonderful sandwich you got for us at the community partnership thing today, I was eating that turkey, and I was like, I got her. I'm sitting the whole time. I'm plotting on you. I ain't gonna lie.
You ain't even gonna let it go. And get it together.
Yeah, I'm gonna give her a chance. We're gonna give her a chance. You need some water? We can get some water. But just give us a little bit of your single, and you can get it on Spotify, right, or Apple Music, and all those good places. We're gonna put all this in the video when we make it. We're gonna put all y'all information in there. But I need you to bless. I need you to bless him because I heard you sing at your birthday party.
He just put me on the spot.
Yeah.
So listen. Yes. So I do. One of the things that I definitely believe, and for me personally, is bringing my full, authentic, transparent self to the space. And so I do have. He just done put me on the spot. Now I don't even hardly know what to do with myself. Okay, so
we just gonna sit over here. Me.
Yeah, we just gonna sit.
We gonna sit right
I'm
here.
just gonna sit over here and listen.
We're gonna listen to all 80.
So the
100%.
song that he is referencing is called "Count It All Joy."
Yay.
I am unapologetically a woman of faith in my space as well, and I do have Shanita Randolph Consulting, which focuses on leadership development and coaching. So I'm gonna end with this. Okay, I can't believe he did this. I'm just gonna sing the chorus. Count it all joy. I count it all. I count it all joy. That's probably not what you're gonna have to erase that part from you. You put me on the spot,
Nope, we're gonna put this, and this is gonna be the first clip we put out. But that was
Beautiful
good.
voice.
That was beautiful.
Beautiful voice.
Bravo. And I bought the single as soon as it came out. You know what I'm saying? I did because I got to support my sister. And I'm like I said, I've been watching your podcast. I'm low key.
Questions you didn't ask.
That's
My
right.
podcast come through.
Come through. There you
That's
go.
Right.
Tell
Naisha
them.
Frey Consulting LLC.
There you go.
That's your girl.
Oh, you got LLC? I didn't know.
Yes.
Oh, okay, consultant.
Yes.
Oh, okay.
NaishaFrey.com. Don't sleep.
Yes.
Okay, but hey, my sister put it all out there.
Yeah, we doing it.
I'm in support of our people.
Yeah, we're doing
Man,
it.
y'all educated black women have blessed me today. And you're both beautiful in your own rights and all that good stuff. I thank y'all from the bottom of my heart. Thank y'all for allowing me to be a part of this great
Thank you for
program.
being a part of our advisory council.
Hey,
Yes.
listen,
We appreciate
I really enjoyed it, and I met some great people. What's her name? They live in Greensboro.
Tasha Cruz.
No.
Tamika Hughes. Keep calling them all out.
Start with a T, yeah, with last name M. She got a beauty salon.
Tamika Campbell Hughes.
Yes, that's Hughes. That's it. Yeah, so that's my girl. She hit me up and sent me. Oh yeah, and I do need y'all to email me that pamphlet. I meant to get one before I left. Y'all got it on digits. The pamphlet with the
one pager.
One pager.
Yeah.
Yeah, we got a digital copy.
Okay, yes, send it to me, please. Yeah,
Okay.
I meant to get a copy before I left, but I didn't. But yeah, man, thank y'all so much for joining the Heat Lab. It's been a great conversation, and I think our audience, when we air this, a lot of people is going. Matter of fact, this is $1 million views, million views right here.
All right, million views
I'm
come
claiming
through.
in Jesus' name right
Amen,
now. It's million
Jesus.
views, million plus views on this right here because I think what y'all are doing and what all y'all collectively all the community partners are doing is very important for our community and for our nation. And I believe if more people had humanity, it wouldn't be about politics. It wouldn't be about religion. It's about human, just having humanity for people.
Exactly.
That's if we had that, I think this country would be a lot better off than where we are right now. But with that said, thank you for joining the Kelvis podcast.
Yep.
Appreciate it. And with that said, we out.